All right, so get this. We're diving deep into the future of healthcare.
Ooh, excited.
And I'm not talking about flying ambulances or, robot surgeons, although
Yeah,
that would be pretty cool.
that would be cool.
We're talking about artificial intelligence, AI.
Okay.
You probably heard all the hype.
Lots of hype.
But today we're going to cut through to figure out what AI actually means for you and me.
Sounds good.
We're going deep with Deloitte's latest report on how AI is shaping the future of health.
It's not just sci-fi anymore.
Right.
AI is already changing the game in healthcare.
Okay.
From how we access care to how doctors diagnose and treat diseases.
So Deloitte breaks down AI's impact into three main areas.
Okay.
First up, patient-oriented AI.
Right.
Imagine, instead of waiting on hold forever, you're chatting with a friendly AI assistant who can answer your questions, schedule appointments, even help manage your medications.
That would be helpful.
It's all about putting you, the patient, in the driver's seat.
Exactly.
Yeah.
This isn't about replacing human interaction.
Right.
But making healthcare more accessible and convenient. Think about it.
Yeah.
You could get your questions answered 24/7 without having to wait for an appointment.
Absolutely. And for those times when you do need to see a doctor, AI can be a powerful tool in their arsenal.
Oh, yeah, for sure.
This is what Deloitte calls clinician-oriented AI.
Okay.
It's like giving your doctor a super-powered sidekick.
Like a superpower.
Yeah.
Think about analyzing medical images. Even the best radiologists might miss a tiny detail.
Uh-huh.
But AI can be trained to spot those subtle anomalies that could mean the difference between early detection
Wow.
and a misdiagnosis.
So it's like having an extra set of expert eyes
Yeah,
working alongside your doctor,
Exactly.
increasing the chances of catching things early.
exactly. And it's not just about images. AI can sift through mountains of data like your medical history
Oh, wow.
and lab results to flag potential risks or suggest personalized treatment options.
Okay, that's impressive.
Yeah.
But what about all the behind-the-scenes stuff, all that paperwork and administrative work that seems to bog down the healthcare system?
That's where the third area comes in,
Oh.
administrative/operational AI.
Got it.
This is about streamlining the nuts and bolts of healthcare automating tasks, optimizing resources, even predicting future healthcare needs.
So imagine a system that can anticipate outbreaks, manage hospital beds more efficiently, or even help with staffing shortages.
Exactly. AI has the potential to make healthcare more efficient and effective,
Yeah.
which could mean lower costs and better care for everyone.
Deloitte really digs into the tangible benefits here. They say AI could lead to increased efficiency, reduced errors, faster drug discovery, and a more personalized approach to healthcare.
What's fascinating is that these benefits aren't just hypothetical.
Right.
We're already seeing real-world examples of AI making a difference.
Oh, I love real-world examples.
Yeah.
Give me the juicy details.
Well, we already talked about chatbots handling basic patient questions, but there are also computer-aided detection systems helping radiologists spot abnormalities in images they might otherwise miss. And AI algorithms are being used to sift through mountains of data to identify promising new drug candidates.
So it's not just about futuristic possibilities.
Yeah.
AI is already here working behind the scenes to improve healthcare.
And that's really just the tip of the iceberg. The potential of AI in healthcare is vast.
Wow.
But there are, of course, challenges to address.
Yeah, it can't all be smooth sailing. What are some of the hurdles we need to be aware of?
Well, implementing AI in healthcare isn't as simple as, flipping a switch.
Right.
One of the biggest challenges is the initial investment.
Okay.
Developing and deploying the systems can be costly and time-consuming.
So we're talking about a significant upfront investment that makes sense, especially when you consider the specialized expertise needed to build these AI systems.
Yeah.
You need people who understand both the tech side and the healthcare side. It's not your average software project.
And then there's the data itself.
Right.
AI is only as good as the data it's trained on.
Of course.
We need to make sure these systems are learning from diverse real-world data sets to avoid perpetuating existing biases in healthcare.
So garbage in, garbage out.
Exactly.
If we train AI on biased data, it's going to make biased decisions.
Yeah,
That's a bit unsettling, especially when it comes to something as important as healthcare.
absolutely. We need to be really thoughtful about the data we use to train these AI models. It's not just about accuracy. It's about fairness and equity as well.
That makes a lot of sense. So it's not just about the technology itself. It's about using it responsibly and ethically.
Precisely. And that's why Deloitte emphasizes that ROI on AI investments takes time.
Okay.
We can't just implement these systems and expect instant results. It requires ongoing training, refinement, and monitoring to ensure they're performing as intended.
So it's a long-term commitment, not a quick fix. And it brings us to the big question. What does all this mean for you and me,
Yeah.
the patients? How can we prepare for a future where AI plays a bigger role in our healthcare?
It starts with awareness. Stay informed about new developments in AI in healthcare. Don't be afraid to ask your doctor how AI is being used in their practice.
So we need to be proactive and informed participants in our healthcare.
Yeah.
Don't just passively accept whatever technology is thrown at us. Ask questions, understand the implications, and make sure our voices are heard.
Exactly. And remember, AI is a tool.
Right.
It's up to us to decide how we use it to create a healthcare system that benefits everyone.
I think that's a really important point. It's easy to get caught up in the hype or the fear surrounding AI, but at the end of the day, it's a tool that we can harness to improve our lives.
Right. AI can help us diagnose diseases earlier, personalize treatments, and make healthcare more accessible and efficient. But we need to approach it thoughtfully and make sure we're using it to create a healthcare system that we all want to be a part of.
Right. So where does that leave us? We've talked about the incredible potential of AI in healthcare, but also some of the challenges and ethical considerations. It feels like we're on the cusp of a major shift in how healthcare is delivered.
Absolutely. And this is where the conversation gets really interesting. What if AI could analyze your lifestyle habits and even genetic data to predict potential health risks? Would you want to know?
That's a big one. It's like having a crystal ball for your health. On the one hand, it could be incredibly empowering to have that kind of knowledge. You could make proactive changes to your lifestyle to mitigate those risks.
Think about it. If AI could tell you that you're at increased risk for heart disease, you might be more motivated to exercise, eat healthier, and manage your stress.
Right. It could be a powerful tool for prevention and early intervention. But on the other hand, I can see how it could also be overwhelming or even anxiety-inducing for some people. What if knowing about a potential risk causes more stress than action?
That's a valid concern. It's not just about the technology itself, but also how we use it and how we communicate the information it provides. We need to ensure that people have access to support and resources to help them make informed decisions about their health.
It sounds like we need to proceed with caution.
Yeah.
Even as we embrace the potential of AI, it's not a simple yes or no answer.
Yeah.
We need to be thoughtful and make sure we're asking the right questions along the way. Yeah, it feels like we're stepping into uncharted territory.
It is.
We're talking about a fundamental shift in how we think about healthcare, moving from reactive to preventative.
Yeah.
It's both exciting and a little daunting.
It highlights the importance of having these conversations now before AI becomes even more deeply integrated into our healthcare system. We need to be actively shaping this future, not just passively observing it.
So it's not about being afraid of AI or rejecting it outright. It's about understanding its potential and its limitations and making sure it's used in a way that aligns with our values.
Exactly. And that's where you, the listener, come in. This isn't just a conversation for tech experts or policymakers. This is about your health, your data, and your future.
So what can we do? How can we be active participants in shaping the future of AI in healthcare?
First and foremost, stay informed. Read articles, listen to podcasts like this one, and talk to your doctor about how AI is being used in their practice.
Knowledge is power, right? The more we understand about AI and its implications, the better equipped we'll be to advocate for ourselves and ensure it's used responsibly.
Absolutely. And don't be afraid to ask questions if you're not sure how AI is being used in your care, or if you have concerns about data privacy or potential biases, speak up.
It's about being an empowered patient, not just a passive recipient of care. We need to be active participants in our healthcare journey, and that includes understanding and engaging with the technology that's shaping it.
Well said. The future of healthcare is in our hands, and AI is just one of the tools we have to make it better for everyone.
So as we wrap up this deep dive into the future of AI in health, here's my final takeaway. AI has the potential to revolutionize healthcare in incredible ways, but it's up to us to ensure that this revolution is a positive one. Stay informed, ask questions, and be an active participant in shaping the future of your health.
Couldn't have said it better myself. The future is full of possibilities, and with thoughtful engagement, we can harness the power of AI to create a healthcare system that's more equitable, accessible, and effective for everyone.
Thanks for joining us on this deep dive. We hope you've learned something new and feel inspired to be a part of the conversation about the future of AI in health. Until next time, stay curious,